video, we'd like to talk about heartburn and hyperemesis gravidarum. Now, heartburn is another common symptom that we see women who suffer from HG report having affecting their life, and also during the pregnancy it's especially severe. And regardless of what type of treatment they receive, the heartburn is not going away. Now, heartburn is not uncommon during pregnancy. It can occur depending on certain foods that you eat, and also maybe laying down for too long after eating, it may occur. But these types of typical heartburn only occur for a while. They are not supposed to be frequently occurring, and it's not that severe. However, the heartburn that I'm talking about today, related to hyperemesis gravidarum, is a frequent occurring thing, and it's very severe to the point where the sharp chest pain is occurring for long periods of times, multiple times a week throughout the entire pregnancy period, because this is caused by hyperemesis. It's a secondary symptom. Furthermore, it can affect your ability to eat because of the stomach acid reflux, and also ability to taste and smell all are affected. And this can cause you to lose a lot of weight during the entire period as well, because you're carrying a pregnancy and it's constantly affecting your ability to eat. It can also affect fetal development and cause potential scarring to the esophagus as well. So as to why it occurs, is because there is some problem with the muscle that is controlling the opening of the stomach cavity, which is known as the lower esophageal sphincter, the LES. Now, typical heartburn is caused when the LES is malfunctioning, some defect causing it to actually open up, and then the food acid reflux occurs, flows back into the your esophagus and sometimes into your mouth as well. That's why you have a bitter acidic taste in your mouth when you have heartburn. However, for hyperemesis gravidarum patients, their situation is slightly different, and also the condition is much more severe. Because of hyperemesis gravidarum H2 receptors binding with HCG, the symptoms are much more severe, and typical treatment is not going to work. These receptors are situated throughout your digestive system. So for patients who have a lot of heartburn during pregnancy with HG, this means that they have an abundant amount of these abnormal receptors situated in the esophagus tract, and also the LES, and also inside the stomach cavity as well. Not only do they experience the LES malfunctioning constantly, it could be spasming, opening and closing non-stop, causing the acid reflux to happen over the entire pregnancy period, or it could be constantly in a relaxed state, causing this heartburn to actually be perpetual, be consistent long periods of time. And not only that, these patients have increased amount of stomach acid secretion because of the same reason, H2 receptors binding with HCG. So these patients are secreting so much of the stomach acid, this intestinal fluids, bile, all of it is mixing together, flowing out the esophagus tract. It can be much more severe than typical heartburn, and it can affect your eating ability, your ability to get any type of rest, because the intense pressure and sharp pain that is constant, and potentially can get worse because you might have difficulty breathing. At that point, you must quickly get to your nearest medical doctor, get the nearest medical support and attention, because it can be life-threatening, as we all know hyperemesis gravidarum is. So as to why typical treatment is not working, because typical treatment is only dealing with the symptoms. You may feel slight relief, however, nothing is going to work. And that's why these patients, sadly, they need to go through their entire pregnancy period with this symptom. But rest assured, Antai Hospital does offer a one-encompassing effective treatment, which is our HG vaccine. Our treatment works because it deals with the underlying cause. Now, you can try it for yourself and observe the relief that you will experience immediately after receiving this treatment. As we've explained multiple times, our HG vaccine works by blocking these abnormal receptors. So once they are separated from HCG, then the symptoms will immediately subside significantly, to the point where you can be able to eat, drink, and the sharp pain in the chest, the pressure will dissipate almost rapidly. This is what we've observed on our patients, and that's why we urge you to seek our treatment and not suffer for the entire pregnancy period, because not only are you putting your baby's life in danger, you're putting yourself in danger as well because of how much it affects your ability to drink, eat, and also the weight loss that you are experiencing. This is very unhealthy and not a state that you want to be during pregnancy. Now, our HG vaccine comes with a full refund guarantee. Now, regardless of any other type of symptoms that you're facing during HG, our HG vaccine works equally for any type of HG condition. HG patients are all welcome to receive our treatment and witness the benefits for yourself. If you do not recover after receiving our HG vaccine, then we are obligated to refund you the full treatment cost as a sign of assurance and effectiveness of our HG vaccine. The treatment is easy to administer via injections, and those who are afraid of injections can also go for oral medication, but it's a case-to-case basis. We need to assess you individually first, but the effectiveness is equal for either injections or oral medications. So please get in touch with us via the website if you'd like to receive consultation or the treatment itself. You can get in touch with our consultants. We can set up a consultation. We can make discussions happen, and we hope to see you at Antai Hospital ideally before pregnancy, so that once you receive this HG vaccine, you can have a full 9 months of pregnancy with no interruptions, no HG, because of how effective our HG vaccine is in preventing your hyperemesis. So I hope that you've learned something in this video. Please stay tuned to our next one, and also leave me a comment down below.